Earlier in the show, we spoke with a pediatrician who told us about how parents can care for their kids' physical health as they transition to go back to school. But what about their mental health? Well, joining us today to talk about what parents can do to support their kids during this time, we have Dr. Elssy Oms. Thank you so much for joining us. She is a psychiatrist with Palm Beach Children's Hospital and Delray Medical Center, joining us now. And Dr. Oms, what can parents do, and teachers as well? Can they work together to support the child's or students' mental health?
Sure. Actually, it's very important to work together. Keep it in mind always that you should start early. Attend all of the teacher meeting events to get your children familiar with their classroom, with the teachers they'll be interacting with. Start communication early with the teachers so that it turns out to be a positive and constructive relationship, especially in case any concerns arise with the children.
Right. And I know this is probably a tough time. It's a transition going back to school after being off for a couple of months. What are some of the, I'm sure there's a lot of emotional things going on right now. Just explain to us that some of the common, just reaction to a child going back to school.
Sure. You can see apprehension in children, and depending on the age, they will show this in many different ways. You have to look for unexplained somatic complaints, headaches, stomach aches, changes in their personality. Sometimes they withdraw, especially if they're teenagers. They have a hard time verbalizing what they're feeling. So it's important to usually be checking in on a regular basis with your children. Talk about feelings and emotions. Be direct with them and get them into the routine of asking and questioning how they're feeling, and that way you can make recommendations and let them know that you're there for them.
And any other warning signs or just something that maybe is overlooked often that parents need to just be aware of, seeing that there's something suspicious? Any other?
Screen time is a big one. A lot of parents complain that children are spending too much time on the screen, but they don't realize that that can be a coping mechanism. Sometimes children use that as avoidance of situations that they're that are difficult for them to deal with. And clearly, when you see that the children are emotionally distressed, again, when it's unexplained, or sometimes changes in sleep, energy, appetite, any subtle changes, ask, question, ask for help. Contact a school counselor, your pediatrician, whoever you can at the moment.
And those resources are available.
Yes.
Sometimes, once the child wants to receive that help, it's always good to know that that's okay to want the help because it is there.
Yes.
Thank you so much.